Psychotherapy. Psychotherapy is performed by a trained professional trying to treat and help people with their problems. First, we have personal growth therapy. It's maintenance and not a cure. Next, and most importantly, we have psychoanalysis or psychoanalytical therapy, which is come up by your boy Sigmund Freud, and it is doctor-centered, where the actual patient sits behind the doctor and the doctor uses free association to talk about the issue. One thing that could come of psychoanalytical therapy is transference, where the patient's emotions are transferred to the doctor. They could be either good or bad. You can either hate the doctor or do dirty things with the doctor. And the final end result of psychoanalytical therapy is catharsis, in which the release of bad emotions occurs.
Humanistic psychotherapy by your boy Rogers. The doctor's face-to-face using reflection, also known as active listening, and you're the client and you cure yourself. Gestalt therapy is very similar to humanistic therapy, except the doctor will try to challenge your feelings.
Next we have cognitive therapy by your boy also, Bandura, where he corrects maladaptive cognitions. Next therapy we have rational emotive therapy, where he teaches you not to be a wimp, a pusillanimous person. You don't want to be that. It teaches you to stand up and fight back. Next and last for this section we have stress inoculation by Michimbom and Karurong, where it is motivates you or cheers you up and cheers yourself up. You know, it basically, makes you happy. They want to make you happy. That's it.
Bear's cognitive is very close to stress inoculation, but instead of words, you have to have proof of being okay. Virtual reality is the treating of pain through video game distraction. There are two types of group therapies. Encounter group therapy, such as anger management or AA, and family group therapy, which is you play a role in someone else's shoes. The magical number for group therapy is between 4 and 8 people.
You didn't even explain what they were.
Yeah, I did.
You didn't say AA.
Yeah,
you
I did.
didn't say play a role in somebody else's shoes.
Yes, I did.
You said there's 2 types.
I said
No, you didn't. No, you didn't.
Yes, I did.
Bro.
Yeah.
Next, we have medical therapy, and there's 3 types of medical therapy. We have drugs or pharmacology or drug therapy. We have shock therapy, and we have psychosurgery. In drugs, there's plenty of drugs such as Thorazine, which is the first used drug, and we also have stuff such as Xanax, a little bit of Blue Heaven, never hurt anybody, and we have stuff such as SSRIs drugs, which are antidepressants, such like. Next we have shock therapy, which is also called electroconvulsive therapy, which is actually when you calm down. So yeah. And we also have psychosurgery, where they stick stuff into your brain and cut out little pieces of your hypothalamus and stuff, so you're not as, messed up as you were. Oh my god! And next, but shock therapy and psychotherapy, they're not used as much as drugs. Drugs a lot.
There are 3 classifications of drugs: antipsychotic, anti-anxiety, antidepressant.
And this is how drugs work. First, antipsychotic medications, example would be Thorazine, is what it does is it cuts the serotonin in the body. Next, we have antidepressant medications such that increase serotonin in the body, such as Prozac, Zoloft, and Paxil. Next, we have anti-anxiety medications such as Xanax or Valium or Blue Heaven, which cause a synergistic effect, bad with others. And that's our psychotherapy presentation. Thank you for... Oh my god, that is cold. That is our presentation. Thank you for watching us. Bruh, that must have been really cold, dude. That water is not at swimming